All right, class, we're back today, and we're talking about the roles and responsibilities of a paramedic. So we've been teaching you how to do things. Now let's teach you the why and what you're responsible for, what you should and shouldn't know. And so let's get right into it. And we've been hammering on the pathophysiology. We've been hammering on the medicines. All these are normal things that we do. And that's part of knowing it, is having that strong background. Again, making a professional attitude and making both medical and ethical decisions, good ethical and medical decisions, and providing emotional support for the patients and their families. I think this is the one that's kind of overlooked a little bit. We get worried about the technical aspects of our job instead of worrying about the human component. And so as you're going through your training, I'm probably going to be focusing a lot more on that human component, because again, you can be technically proficient but still be a horrible caregiver, and that's what we are. We're caregivers in this situation. So again, ongoing training for our preparation. I think this is one that we probably fall down on a lot, but using doing aerobic exercises, stretching, loosening up, understand the biomechanics of lifting. If you have met somebody who's been in the EMS business for a long time, you're probably going to find a certain amount of back injuries that have happened because of it, and how to make sure that you don't succumb to the stress of the job itself. And it's a very stressful job. It's a very high performance job, and again, you're working very long hours for not as much pay as other professions. And so, again, it's no wonder people want to leave the profession, because you can get better compensation, better hours, better working conditions. So, again, when you get to work, check your truck, check your truck, check your truck, check your truck, check it again. So make sure that your vehicle has been inspected. Make sure that you've got fuel in the truck, because the truck is great. You can have the $150,000 of equipment on it, but if it's not going to roll out a driveway, there's no sense in even bothering. Make sure that everything's restocked, because again, and always check it. Don't take the word of your off-coming crew. It only takes that one little thing that they forget. I guarantee you'll need it on the next call. Again, you got to know your EMS policies, protocols, procedures. You have to know all these things. Again, you got to know how to work the communication software. Again, some of them are not as simple as grabbing the mic and just pushing the button. You got to know your local geography. You got to know where calls are. You got to know the names or the common names of roads, subdivisions. These things are all used to expedite us getting there. And know what our agencies do around us. Where are the lines? Is this station 1s or station 4s? All of these things come into play. And so, again, remember that we show up at the scene in the ambulance. That is our office in a way, but also that's why the stuff is portable. We can carry it into the patient. As you're responding to a call, your safety is the number one priority. You're no good if you can't show up. Put your seatbelt on. Get to the call safely. Get to the call securely. There is zero reason for rushing. Okay, monitor the road. Check for potential hazards. And by the way, your partner should be doing that as you're going to the call, as well. Just because you're in the right side of the ambulance doesn't mean it's not an important seat. Again, find the place, find the quickest route. Request additional resources based upon the information that you have, and always expect a high-risk situation. I think that's another big one that we miss. Matter of fact, the couple of times I've actually been shot at were medical emergencies, and calls that you would not normally think that somebody pull a gun out. Well, they did, and so you got to be alert and awake, and ready for these things at all times. You got to be ready for situations that might lend itself to having more than one patient, or worse yet, requiring special resources. Okay, and we all know that one place in our zone that the violence is definitely prone to happen at. And again, you should bring friends with you when that happens, whether it be an engine crew, more additional resources, or law enforcement. Those are the folks that you need to bring there. The problem with law enforcement nowadays is that they're spread thin too, and so again, you can't over-rush resources to an area. So you use a little bit of a balanced approach to that. Make sure that you're safe, but at the same time, don't tie up resources when you don't need to tie them up. Again, check your scene as you're coming in. Your scene size up starts before you even get there. Remember that you and then your crew, then your patient. I can't stress that one enough. And any scene has that potential to deteriorate. Looks like a bad day right here. So look at your hazards as you approach. What hazards do I have on this call? Do I have a tanker truck? Do I have the traffic definitely is playing a factor here. All kinds of things can be a hazard of these types of scenes. You got to definitely be careful, both mechanical, other people making bad decisions. When you get there, number of patients, again, mechanism of injury or the nature of the illness, we want to find that out. We want to find out our general impression of our patient. Check your responsiveness. Walk up, say hi. If they don't answer, again, assess your ABCs. Again, CAB if they're not talking to us. Check for immediate life threats. Anything that's going to stop from air going in and out, blood going round and around. You need to fix that immediately. And then decide whether you need to continue your assessment or you need to transport immediately. And again, your primary assessment, guys, it takes the patient's medical history and you continuously monitor it. And again, you can do this kind of simultaneously as you get better at what you're doing. Again, and again, if they can't talk to you, obviously it's very difficult to get history. But again, don't forget about your bystanders or other people around you. Again, treat life threats first, okay? Again, air goes in and out, blood goes round and round, and if it breaks that rule, then you should fix it immediately, okay? Again, recognize what the illness or injury is. Prioritize them based upon, hey, is this a stay and play or is this a load and go and let's ride? Is it something that I can stabilize there? Again, and those are questions that are very situationally dependent. Again, most of the time, the adage of scoop and run, it works for a lot of things, but it's not the end-all, save-all method of approaching a patient. Again, your medical direction, again, we talked about this during Chapter 2. Again, they can instruct you on how to do this. I think that this role is actually going to expand a little bit more, especially with telemedicine, because, again, paramedics can actually call the doc and show them what they're seeing and let the doc help them guide the treatment plan. I think that's a really good idea and a really solid approach, by the way. Appropriate decisions. Again, you make the appropriate facility based upon what is wrong with them, what's going to fix their problem. Again, if this person has a mild infection, yeah, sure, the community hospital's fine. If this person's got a sword stuck through them, I think a trauma center is the way to go. Don't take them to the cath lab. Even if they're stabbed through the heart, don't take them to the cath lab. Because, again, they're going to need specialized resources, and you got to know what the resources are and available in your area. All right, so make sure that you accept the appropriate facility and know your responsibilities. Know what medical facilities have, what their services are. And, again, usually facilities are very good about telling you what they provide. They want you to bring patients to their facility. Okay? And more importantly, they'll also tell you what not to bring to their facility, okay? So again, usually when they're talking about the levels, usually they're talking about trauma centers. Level 1s are the regional trauma centers and their tertiary care systems, and they're usually at a university-based teaching hospital. Level 2s have they can do additional trauma care despite injury. Usually they don't offer pediatric or burn specialties, where the level 1s do that as well. Level 3, again, they serve communities that don't have an immediate access to a level 1 or level 2. And then your level 4s, it's pretty much any emergency room, okay? It's when the care is not available. This is more like your community hospital situation. But the good thing about designated trauma centers, guys, is that they offer very unique services. And again, So, like, I'll give you an example, Shan's Level 1 Trauma Center. They provide all of those services listed there. And when you're in doubt, call your medical control, or part 2, call the facility that you want to transport to. Say, hey, this is what I got. Can you handle it? Yes or no. You'll be surprised how that phone call can really make a difference, and it builds rapport and respect, by the way. So in some areas, the paramedics provide primary care and then they transport, and I think that's important. In a matter of fact, certain places, they actually do treat and release. A diabetic call would be a really good example. Why are we taking somebody who's got diabetes, we know is taking insulin, they had an episode of hypoglycemia? Why are we taking these people to the hospital when they had a sugar low? We can give them D50. We can make sure that they eat there at the house. We can monitor them for 20 minutes, and then we can treat and release. Okay, and it's probably one of the few cases I would say where that's okay to do. Again, if it's the second or third trip we've come in the last 2-3 days, well, then we got an uncontrolled diabetes situation. In that case, it's probably a better idea to transport the patient. When in doubt about the patient's stability for duration of transport, you need to contact your medical director. And then handoff before removing the patient from the hospital, request a verbal report to the primary care provider. Again, you're going to hand off your patient to your nurse. In certain places, the doctor actually comes in. And unfortunately, sometimes we end up giving the report 2, 3, 4 times. It does happen. Again, your first priority during transport is the patient. Kind of a duh statement. But again, and then you need to document to provide sending facilities the turnover. So again, make sure that you give them a copy of your run report. That is a legal requirement. Not only is it a legal requirement, it's just good patient care so that they know what you did. Usually we leave a worksheet there to start with, and then when you finish your PCR, it's actually electronically transmitted nowadays to the hospital. So you leave a copy of the report there. Documentation. If you didn't document it, it wasn't done. I can't stress that one enough. Your patient care report needs to be completed in its entirety as soon as you possibly can. And then again, notes should be taken and copied onto the report. And it's important to make sure that you get complete documentation. And record any observations. Make sure it's fact-based. No opinions in that, okay? Opinions are going to get you in trouble, especially with a really smart attorney. He's going to tear it apart. So stick to the facts. Stay to the facts. Again, returning to service. It's wonderful that we can sit there and write our report at the hospital, but the long and short is people get sick. They keep getting sick, and we got to be there to help them. So get your truck cleaned up, properly discard, decontaminate everything, make sure the unit has plenty of fuel. It drove me nuts as a supervisor that the crew would tell me that they're at low fuel when they've been sitting at their station for 4 hours with a fuel tank sitting right outside. I'm sorry, why wasn't the truck fueled? And the simple fact of the matter is your truck should be ready to go. Pretend like you're not going to get back to your station for another 24 hours. And by the way, sometimes that does happen. Check for times for stress, and again, assist anybody that needs help. We have a tough job. Long and the short, we need to make sure that we're ready. And that means that we see some things and it's going to trigger some emotions, and we got to be able to deal with those emotions, because if we don't deal with them, we're probably going to deal with it by acting out and doing bad things to our patient. Now, there's other things that we do in the EMS field, okay? Do we train people how to do CPR? Do we help do demonstrations? We teach first aid classes. Do we do all of these things? Absolutely we do, okay? If we're not running a call, we're getting ready for the next one, okay? It's a common statement that I use. So again, professionally developing yourself is definitely one of those things. Don't forget about your station duties, making sure you're record keeping. There might be special projects that you're assigned to. And again, interagency relationships. This can be as simple as showing up and having dinner at a station with a crew, or again, bringing dinner to the house and sitting down at the table with them, to actually have formalized meetings. These all are building exercises that you should conduct. So your community, again, make sure that your public knows how to get a hold of you. Make sure that they know the basic things until you get there. And it's amazing that, just a little bit of effort saves lives. Stop the bleed campaigns. Very good. Teaching that CPR class. Teaching people just to hold direct pressure on a wound until somebody gets there to help take over. It's surprising how doing those little things go a long way that, again, help save a life. Again, remember, we should be promoting wellness, primary care, and reduce the burden on the system. If the person doesn't need an ambulance, again, it's not costing as much to run your system. And some would argue that, well, that way we don't make money. Well, it's actually kind of a good thing, I think. So, again, patients receive appropriate emergency care based on need, by the way, and not cost. So, again, we render aid no matter whether they're able to pay or not. By the way, that's not only law, but that's the very ethical thing to do, okay? Citizen involvement, again, it helps the outsiders. It gives them equality. We used to do ride-along programs where they would come and ride with us, and you would show them what exactly you did during a day. Again, remember, we got a certain number of CEUs we got to get every 2 years, but it's making yourself better, and it makes you able to respond to the calls better, and it gives you new information that you can use to help. Sometimes this one's a little tough, but especially 3 o'clock in the morning, you're tired, you're on call number 20. This is a tough one, guys, but it's what separates you from being that professional, separating. Giving in to your tiredness or your emotions. It's very, very true statement. You promote quality care. You set and strive for the highest standards. The use of colorful metaphors, if you will. We shouldn't be doing that, again. And earn the respect and confidence of your team members and the public. How you carry yourself says a lot. And you should do that. By the way, you should also look the part. I 100% believe that. One of the things you guys may or may not know is when I'm on a truck and I'm in uniform, I'm in the uniform. It needs to be clean. It needs to be good. It needs to be pressed. It needs to have those things. It needs to have the proper labelings on it, the proper uniform, if you will. And again, it's amazing how people who might be the dumbest people in the world, but they'll flock to the person in the uniform because that uniform kind of says, hey, I know what I'm doing. Whether it does or doesn't is another thing. Again, versus somebody that doesn't look as professional. Now, professional ethics, those are the rules or standards that govern the conduct or members of a particular group or profession. I would probably know that definition. And again, ethics, by the way, are not laws, but they are the standard for honorable behavior. And again, it doesn't mean that you're doing something illegal, but you could be doing something unethical. And usually, by the way, you'll be surprised how much those two lines kind of run together. And the conformity of ethical standards, it is expected. And you are held to those standards, by the way. And that usually is written into legal definitions, so I would be careful about that. Again, the Oath of Geneva was in 1948, where that's where the guiding principles for EMS was, and then the EMS National Code of the EMT National Code of Ethics was developed in 1978. It's actually worth a good look if you take a look at that in your books. So again, practice, present yourself well, keep yourself educated, keep yourself refreshed. That helps burnout in ways you don't actually understand, and set those high standards for yourself. Set that bar high. And again, maybe you don't reach that bar, but you're going to maintain that professionalism, and very much so. It's very important. Look at your performances. Seek out feedback. Make sure that, ask for people how you're doing, okay? It shows the other people that you care and you're ready to go and you're able to do these things. Now, again, your professional leadership, leadership, integrity, empathy, self-motivation, all these things, self-confidence, professional appearance, and hygiene. Again, kind of talked about all these before. How you carry and conduct yourself says far more than what you say about yourself. Okay, so again, this is an example. Again, look at these. They're acting in a professional manner. They are prepared. They've got the equipment there. They're doing their job. They look good doing it, by the way. So these are things to think about when you're dealing with this professionalism attribute. Again, respect is kind of a really big one, guys. Never let your never let your demeanor affect your manners. Never let your mood affect your manners. Be respectful. You'll be surprised how far yes sir, no sir, yes ma'am, no ma'am goes. You'll be very surprised. Diplomacy, the art of telling somebody to go to hell, and they look forward to the trip. Very much so. And that is a skill that I guarantee you have to work on. You have to work on that. You have to work on that. Seek first to understand, then to be understood. You'll be surprised how using those simple principles does has wonderful attributes when it pays it back to you. Because now that again, it works better. The last thing on this is my former chief of mine always said this: be nice. And I can't stress that one enough. Do the right thing. Be nice. Okay, and the rest of it should fall in line. And again, be nice. Even when they're doing really bad things or really mean things or really awful things, be nice. And again, I will tell you this, is when you're not nice is when usually whatever it is that you did, it's probably wrong at that point. All right, so again, make sure maintain your responsibilities. Make sure you keep your licensure up. Again, in the state of Florida, it's every 2 years. You got to have 32 CEUs. Okay, but for other places, there are different requirements. There are some systems that requires a person pass a 12-lead test every 90 days. This is part of you keeping up with the emergency healthcare delivery system, and it is, again, so important. All right, so again, if you're not responding to a person, you're probably getting ready to respond to a person. So that's kind of the essence of this chapter. Make sure that minimize your call load by helping out others. Those non-emergency assignments are just as important. All right, that's it for today, and I'll see you guys on the next one.